Welcome to it. I am Dr. Muhammad Talat, Assistant Professor of Radiology at University. Let us continue our course. As we saw in the last video, that we have a young adult patient presenting with focal neurological deficit. And the last non-contrast CT scan shows hypodense vasogenic brain edema located at the left high parietal region. We did for the patient contrast enhanced MRI study. And if I want to report this case, I will start by the lesion. The left high parietal region is a seat of small, well-circumscribed space equine lesion having subcortical inlocation. The lesion shows smooth border, as you see. The lesion displays iso-intense signal intensity in T2 with image, and its core displays a dot of dark signal. In the T1 with image, it's characteristic with high signal intensity or relatively high signal intensity along its border in the T1 with image. So we have some important criteria. We have smooth border, and we have relatively high T1 signal along its border. So the border of the lesion is characterized by smooth outline and relatively high signal intensity in T1 with image. The lesion is surrounded by finger-like projection of vasogenic brain edema, and this vasogenic brain edema displays high signal intensity in the T2 with weighted image and low signal intensity in T1 with image. And also it causes mass effect in the form of effacement of the cortical sign. Again, as we described before, that the criteria of vasogenic brain edema, one of the criteria is ill definition between the edema and the normal brain tissue, ill-defined border. Also, finger-like projection, as we discussed before. Again, the gray matter itself is preserved. The gray matter preserves its normal signal intensity. Let's go to comment on the diffusion weighted image, but before moving to the diffusion weighted image and ADC map, I would like to illustrate some important tips, especially for the juniors. Let us review together some basics in the diffusion weighted image. If we have a lesion displaying dark signal intensity in the diffusion with corresponding high signal intensity in the ADC map, this is typical facilitated diffusion. So no diffusion restriction. If we have a lesion with bright signal in the diffusion and corresponding low signal in the ADC map, this is a typical form for diffusion restriction. If we have a lesion with bright signal in the diffusion and the bright signal in the ADC map, this is considered as T2 shine through effect. Okay, T2 shine through effect is considered as not diffusion restriction. So this one not diffusion restriction, this one not diffusion restriction, this one is typical form of diffusion restriction. According to what we described before regarding the morphological features and signal intensity of the left high parietal subcortical lesion, we have two top differential diagnoses, either brain metastasis or brain abscess. Let us see how can the diffusion weighted image helps us in differentiation between both of these entities. We have some special forms. If we have the margin displays high signal in diffusion with corresponding low signal in the ADC map, so the margin is restricted diffusion, while the core dark signal is diffusion with high signal in the ADC map, so it is not restricted diffusion. So the restriction only limited to the margin of the lesion. This one is suggestive of being metastatic lesion. While this lesion totally bright in the diffusion and totally dark in ADC map, it appears as a black hole in the ADC map. This one is characteristic for the abscess. Sometimes we have very odd for high signal in the diffusion peripherally, while its core dark signal, while the ADC map is totally dark signal. So we have black hole in the ADC map, and the ADC map is more sensitive than the diffusion, so it is dominant on the diffusion. So it is considered as totally restricted diffusion as well. This one is suggestive of being abscess. So those are the most important points that we need to emphasize before discussing our case. So again, let's move again and see our case. We will see this is a vasogenic brain edema, bright signal in T2 and low signal in T1. And at the same time, it is dark signal in the diffusion and the bright signal in the ADC map, so it shows facilitated diffusion, no diffusion restriction, and this one is typical for pathogenic brain edema. Regarding the lesion itself, it appears bright in the diffusion in spite of having a dark dot of iso-intense signal at its core, but the lesion almost show black hole in the ADC map, so it is considered as restricted diffusion. In the post-contrast series, you will see intense marginal contrast enhancement, so we are dealing with ring-enhancing lesion. And the very characteristic point in the post-contrast study that the inner border is very smooth, as you see here, smooth inner border. So we are dealing with a ring-enhancing lesion. Let's see how can we deal with a ring-enhancing lesion and what is our differential diagnosis in this case. So we are dealing with ring-enhancing lesion at the left hyperactive region. I have here my own mnemonic that helps me too much to think in our differential diagnosis. Magic Doctor. I hope all of you will be Magic Doctor. Magic Doctor M for metastasis, A for abscess, G for glioma, high aggressive gliomas can show central necrosis and at the same time marginal contrast enhancement. I for infarct, subacute infarction. The blood-brain barrier at the subacute infarction will be disrupted, not like the acute cerebral infarction. In some cases of subacute cerebral infarction may show marginal contrast enhancement, but this one is very rare. Cerebral contusion, very rare to inject IV contrast in cases of cerebral brain contusion. Demyelinating, D for demyelinating, most likely tumefactive MS, sometimes gives like ring-enhancing lesions, also radiation and radiation necrosis. The most common differential diagnosis, the first two, metastasis and abscess. So let us go more deep in these two entities. So we have cerebral abscess, sometimes septic emboli, shows marginal contrast enhancement. TB as well, very important. Tinea solidum, toxoplasmosis. Those are 3T. Most likely biogenic abscess, very important. And thus, sometimes lesions doesn't show complete ring enhancement, and we can call it open ring enhancement, and sometimes we can call it arc-like enhancement. We have two common lesions. First is abscess, second is demyelinating process, particularly tumefactive MS. Abscess will show open ring enhancement, and the medial aspect of the ring shows no contrast enhancement, so it is opened medially, while demyelinating process or tumefactive MS shows no enhancement laterally or towards the outside. So the opened side is outside or lateral or along the lateral aspect of the lesion. This is one of the most characteristic points in case that we have open ring contrast enhancement, and this one is one of the differentiating points between abscess and demyelinating process, particularly tumefactive MS. By the time we can forget which one is opened inside or outside. The abscess can extend medially to open into the ventricular system and cause ventriculitis. So remember all the time that the abscess, if it is open ring, it will be opened medially, not laterally. While the demyelinating process will show the opposite direction of the open ring enhancement. So let's concentrate at the two most important entities in our differential diagnosis, metastatic lesion and abscess. Both of these lesions are mostly located at the gray-white matter interface because it is considered as hematogenous spread. The history, if we have history of primary tumor, it will suggest metastatic lesion. If the patient is immunocompromised, it's going with abscess. Clinical and laboratory findings and the inflammatory markers, it is not present in the metastasis, but it's present in the abscess. Regarding the imaging findings, in the T1 with image, the border of the lesion in the metastatic lesion, either ISO or low signal intensity in the T1, but it's very characteristic to be relatively high signal in the T1 weighted image in the brain abscess. The inner border is irregular in metastatic lesion, while it is smooth in the brain abscess. Regarding the diffusion width image, the border of the lesion will be restricted, the border only, but the core will show facilitated diffusion, while in the abscess, the core and the margin, both of them shows restricted diffusion. If we want to apply to our case, the patient is immunocompromised. Let us take another color. The patient is young adult and immunocompromised. We don't have any history of primary tumor. The clinical and laboratory findings really, it is not typical for the abscess, it's borderline. The lesion shows relatively high signal intensity along its border, going with abscess. It shows very smooth outer and inner border, going with abscess. The lesion shows restricted diffusion, going with abscess. So most of the signs are suggestive of being brain abscess rather than metastatic lesions. Really, the patient underwent surgical intervention, and it is pathologically proved to be a brain abscess. Thank you so much, and I hope you enjoyed our lecture and our teaching points. Thank you.